So how will this money be used?
So this is funding from the Medical Research Future Fund. It will now be open for proposals in relation to childhood cancer research, for understanding the origins and pathology of childhood cancer, and from that, diagnosis, treatment, and potentially a cure. And if we save one life, that will be enough. But my hope and my expectation is that this will help advance the saving of many lives from children's cancer, which is immensely important, absolutely everything for an individual family, but it's also something as a community and as a society that's just so important.
Just onto the hotel quarantine, the inquiry that's been taking place. It's finished now, Minister. Still, no one's owning up to it. Who was responsible for hiring that private security firm? I just want to ask you, perhaps with your health minister hat on and as a Victorian as well, how frustrating has this whole process been for you with all of those details that are emerging, but yet no one's owning up to it?
Well, I think the inquiry will make its own findings. My focus, as you say, with regards to the health role, is to make sure that Victorians are safe. The numbers are coming down around Australia. No community transmission cases outside of Victoria yesterday, 5 within Victoria. What that means is that Australians have done an incredible job together. So we're keeping the country safe. And importantly, that means that we can get Victoria on that road back. And the mental health is something that's huge. And we've seen powerful letters from the general practice community about the mental health of children. We know that there are so many people who are suffering in Victoria now because of the way they've been locked down, because of the restrictions. And if we can lift those safely, we can get them back to work, we can give them the dignity, we can give them the space, we can give them the freedom, and that will mean long-term people's health and mental health will be far better.
Jenny Mikakos, the now former Health Minister of Victoria, she used the word eradication yesterday in a tweet. It perhaps provides a window into the Victorian government's thinking. What's your reaction to that, and does that concern you?
Premier rejected it. I'll leave that for the Victorian government to explain. What we know is that with low numbers of cases, New South Wales, through its testing and tracing system, was able to manage those cases but keep the state running. And when I say running, it's the simple things of people being able to be outside in a COVID-safe way, to go to work in a COVID-safe way. And we have to recognise that, as New Zealand saw, cases can come and cases will come. Unless we lock ourselves off from all imports, from all returning travellers of Australians coming home to be with their families or their friends for significant moments in their lives, then you can never eliminate the risk, but we can manage it. And we just need to look at the rest of Australia and the way that's been done, and that provides the model for Victoria. Really strong contact tracing and testing is what's going to protect us.
Yeah, I know, and I hear you when you say that the Premier rejecting it, because he did. But doesn't it seem to you that, you know, with him saying that there's got to be no new cases for 14 days to get to COVID normal? I mean, that sounds like eradication to me.
Well, the Prime Minister, the Treasurer and myself respectfully asked Victoria to review those thresholds. The epidemiologists, people such as Professor Peter Collignon, Professor Catherine Bennett, the Dean of Melbourne Medicine, Professor Kapoor, have all indicated that they are concerned that those thresholds may mean an inadvertent long-term lockdown, which would mean that small businesses, restaurants, cafes could be almost permanently trapped in a cycle of closure or reclosure.